to cast their ballots traveled from their homes, and they can then achieve both casting their ballots, but also an opportunity to vaccinate in one trip. We welcome the fact that this has the support of political parties, and no political party has raised any concern in terms of creating this opportunity for members of the public to be able to have another opportunity to receive a vaccination closest to the voting stations. Once a person has voted, they then can proceed to the pop-up site to be registered and then vaccinated. To make it even more convenient, to have just one trip, priority will be given to the use of the Johnson & Johnson vaccine, which, as we know, it's a one-dose vaccination, but so that people can just have one trip and not have to come back. But for those who will prefer the Pfizer vaccine, that will also be available. This will also cater for those who may just be needing their second dose of the Pfizer vaccine. So this will be available, although largely it will be the Johnson & Johnson, so that people can be able to be fully vaccinated after the one dose. We again want to thank our health workers who raised their hands to be on duty on the voting day, and also again the Independent Electoral Commission for their support and cooperation in making this arrangement and giving opportunity again for South Africans to be able to cast their ballot and at the same time be able to be vaccinated. We're also happy to announce some incentives, various businesses which have come on board to provide incentive, specifically on the voting day. Nando's chicken, a very famous chicken outlet, has donated 500,000 worth of incentive for the healthcare workers for a small competition on voting day, on election day. Nando's is offering 1,000 vouchers valued at 500 Rand each, which will be awarded to members of 15 best performing teams in each of vaccination sites in each province, which means that there will be 135 vaccination teams spread equally in number of 15 in all provinces, in all 9 provinces, which will benefit with each team member of those best performing receiving a 500 Rand voucher for the Nando's chicken, which will be awarded after elections day. We appreciate this gesture and hope that other businesses will come forward to offer more products of their products in appreciation of our hardworking health workers. In addition, Uber, the providers of traveling, has also offered free rides of up to 100 Rand each for the health workers who will be on duty on election day. We know that the Uber services are not available in rural areas, but we appreciate the gesture again in those areas where Uber services are available, so health workers can be able to receive a 100 Rand free trip on election day from Uber. So we appreciate every form of incentive which encourages our health workers, but also which also encourages people to participate in the vaccination program. The list of the pop-up vaccination sites will be available on the SA coronavirus website, but also this list can also be found on the National Department of Health website. Still talking about the incentives, I'm also happy to announce a pilot scheme valued at a figure of 26 million, designed to benefit 260,000 people over the age of 60 who will receive their first vaccination during the month of November 2021. Those who fall within this group will qualify for a 100 Rand grocery voucher called the Vuma voucher, which can be redeemed at ShopRite, Checkers, and USafe stores. This will be on a first come, first vaccination, first serve basis. The voucher will be sent by SMS to the cell number which will have been provided at registration for vaccination. This scheme is sponsored by, amongst others, the DG Murray Trust, Alan and Jill Gray Philanthropy, Bill and Melinda Gates Foundation, Elma Vaccine and Immunization Foundation, Michael and Susan Dell Foundation. We hope the pilot will be a success so that it can encourage other companies also to come forward and provide other incentives. And we welcome in other initiatives which we are aware are still being considered by various companies in consultation with our management team. The vaccination program has retained a steady momentum, and as of yesterday at 6 p.m., we reached another milestone of just over 22 million doses administered, the total number being 22,118,947 doses administered to just over 15 million individuals, the total being just 15,078,000 individuals with at least one jab. Now, this gives us a coverage of the adult population of just under 38% of the adult population, but also 37.9, which is just under 38% of the adult population, with just over 12 million, that's 12,140,000 people who are now fully vaccinated. Now, this constitutes a figure of 30%, a proportion of 30% of the adult population. We are therefore confident that by the middle of November, we should be able to reach the 40% coverage of all adults with at least one dose of the vaccination. But we are also happy that we see a much more steady and consistent return for the second dose of the Pfizer. So as much as we emphasize that this includes also those who have received the first dose of Pfizer, we see a much more consistent return for those who have received the Pfizer vaccine coming back for the second dose. So this is not a major worry as much as it was pointed out previously. A lot more people are returning for the second doses. So we're getting closer and closer to the 70% of coverage of the adult population. We are especially optimistic about reaching 70% of the over 60 age group. And also we are very optimistic about getting very, very close to 70% also of the 50 to 59 years cohort by the end of December. We again urge everyone to take advantage of the current low levels of infection to come forward to receive their vaccination before the expected fourth wave hits our shores. The vaccination of the 12 to 17-year-olds is proceeding steadily, with just under 100,000 by yesterday, short of 100, 99,900, so just 100 short of 100,000 already vaccinated with the one dose Pfizer, and 183,700 registered. We expect these numbers of the younger people to pick up once school holidays begin, once the school exams have finished. On the vaccination certificate side, by yesterday, just over 2.8 million certificates had it. The security of the certificate will be enhanced during the course of next month, during the course of November. Now, I want to again just emphasize that our main focus remains on the vaccination of the adults, but we are providing opportunities also for the children below the age of 18 to receive their protection from the COVID-19. And we are hoping that the parents will bring their children forward so that they can also be protected, so that when the schools reopen after closure, the 2022 school year will begin with most of our secondary school learners having received the 1 dose of Pfizer vaccine, and which will provide them with sufficient protection against serious illness from the COVID-19. So as I conclude, I wish again to urge all South Africans to heed the call to protect themselves, to protect their families, protect their friends, their neighbors, and co-workers by taking the vaccine. The nation's future is in our hands. Let us keep safe in the last 3 days of the election campaign, and let's make sure that we vaccinate before the elections, on election day, and also after the elections. Thank you. Thank you very much, Mr. Mohale.
Okay, I didn't move. Thanks, Minister, and thanks, colleagues, and thanks for that keynote address. Without wasting any time, I'm going to call upon the Deputy Chairperson of the Independent Electoral Commission, Ms. Janet Love. As we know that for us to say the elections are free and fair, it means they are violence-free. People are able to choose for their candidate without being forced. But in health, the definition of free and fair elections, it means there was high level of compliance with COVID-19 regulations. So I'm going to hand over to Ms. Love to take us through the state of readiness as far as the compliance of with the COVID-19 regulations concerned. Over to you, Ms. Love.
Thank you very much, and good morning to everybody. I'm going to share a presentation because I think taking people through the process is going to be easier if we have some slides that are able to be seen. So let me do that. I hope that's visible. Okay, there we go. Okay, so the Commission, excuse me, first of all, in the introduction, it was indicated, excuse me, it was indicated that the elections are happening in 2 days' time. For the Commission, as many of you will know, the elections actually start tomorrow. So what I'm going to cover in this presentation, after just giving a little bit of background, is to look at preparations of voting station, how we're going to be dealing with special voting, that is on Saturday and Sunday, what happens on voting day, and of course, what we deal with in terms of our safety measures after the voting station closes. So in terms of the background, as all of you will know, in May, in response to the concerns of political parties around their campaigning, around health concerns, even during elections, we asked Justice Moseneke to hold an inquiry, and he did so engaging a number of stakeholders, including scientists from the Department of Health and various other medical experts. He also was able to draw on the electoral practices in countries throughout different parts of the world, and he issued his report in July. Now, among the recommendations, Justice Moseneke commented in particular on the importance of vaccinations and also raised certain proposals in terms of COVID-19 protocols. We had tested many of these protocols during the course of our by-elections at the end of last year, when COVID levels were enabled us to hold those by-elections. But at the same time, we were able to draw on some of the input that we got from this report. And I think what I really wanted just to emphasize from the point of view of the Commission is the huge thanks that we would like to express again to the Department of Health and to the medical experts who have really worked very closely with us to enable us to navigate through our responsibilities in terms of best practice. In terms of the preparations, at the moment our PPE provisioning for every voting station involves hand sanitizer, and obviously the quantities will vary. Have disposable bins with lids for things like cotton buds and other PPE disposables. We have canisters with disinfectants to enable some disinfecting of the surfaces that are going to be very consistently used by different people, such as voting booths. And we have some posters to clarify the procedures. In addition to that, every official has been equipped with face masks for every voting day. Our whole campaign around this is really to encourage people to bring their own pens, to ensure that people's hands, both the officials as well as voters, have sanitized their hands at different stages, certainly before entering the voting station, that masks are compulsory, and that we keep our distance to the 1.5 meters in every extent possible. So the routine for every voting day, and so I put this here because this would include a routine that happens on each day for special votes. That's for Saturday, for Sunday, and for Monday. These are the routines the presiding officer will open, has to ensure that everybody sanitizes hands, has to ensure that everybody wears the masks, has to sanitize materials in the voting station. As I say, if there are things that have been potentially touched by various hands in terms of things like the voting booths, and would then sanitize hands after material. Party agents are informed, observers are informed, they have got to have their own masks and they are obliged to sanitize. In terms of special voting, I use this opportunity also just to remind us all, special voting will commence tomorrow at 8 o'clock in the morning, and that's for home visits and for visits to the voting stations. Home visits are ones which are requested at the time of the application for special votes and are provided to those who are infirm or have difficulties with mobility. The home visits follow a planned route and may continue beyond 5 o'clock until that particular route is completed on each of the special voting days. Presiding officers receive the lists of approved special votes, and a double envelope system is used. Voters who then cast their votes are marked off the approved list. Many of you will know our double envelope system, but just to remind us all, we have a smaller envelope that is unmarked and provided to the voter. After the ballot papers are given to the voter, depending on the number which depends on whether they are living in a metro or in an area that is covered by a district municipality. They will be given their ballots with the envelope, the small envelope. Once they've marked their ballot, those ballots will be placed in the smaller envelope. The smaller envelope is then placed in a larger envelope. The smaller envelope is sealed, and the larger envelope on its outside will have the identity number of the voter marked on the outside. That will then enable voting officials to not only mark off in the presence of party agents those voters who are on the special vote list from the special vote list, but also to ensure that people are deleted from the printed voters roll. So in preparing for special voting, again, when it comes to the routes, as I've said, these routes are shared with party agents and observers if they are there and ask for the routes. Party agents in a municipality are informed. They also need to be sure that they provide their own transport, and they need to be understanding that no mask means no accompanying on the visit. When they arrive at the place, I will go through what happens there. Right from the commencement of any route that is started, these materials have to be checked on and to be in place, particularly the adequate sanitizer. So this is sort of very much from the training material that every voting official has been provided with. They are obliged not only to identify themselves to the voter, they have to sanitize their hands before proceeding. They have to ask if the voter wishes to have sanitized hands or use their own sanitizer. They have to maintain distance as far as possible. We know that some residents may very constricted, but there is every effort going to be made. When they check IDs, they've been trained to ensure that they avoid touching. And of course, if they do touch, they will then sanitize hands again. And they then proceed to ensure that they mark the thumbnail of the voter with indelible ink, using a disposable pad as opposed to the pens. So again, this is the material that is taken on the home visits, including the sanitizer, and the provisioning that is made during the home visits is then provisioning that happens on each of the days, Saturday and Sunday. In the voting stations, which will also open both on Saturday and Sunday, again, this the station will be prepared. Any queues will ensure the voting officials will ensure that the distance of 1.5 meters is maintained. The checking of the ID documents will be undertaken, avoiding touching. Any touching that does take place unavoidably will be followed by further sanitizing of hands. The marking of the thumbnail and part of the cuticle of the voter will be done with the disposable pads, and then the procedure of issuing the ballot paper, which is stamped at the back, 2 or 3 ballots, depending on which municipality, will then proceed. The voting, the voter will be then directed to a booth, even in a voting station, if it is a special vote. The same double envelope system will be used, the smaller envelope inside the larger envelope. They will be explained how to deal with those 2 envelopes. They'll be directed to a voting compartment, and after voting, they will place their marked ballots in the smaller envelope and place the smaller sealed envelope in the outer envelope and place them in the ballot box. Election officials, although we have indicated to voters that they may bring their own pens, but if they don't, election officials will make sure to sanitize the pens and on a regular basis will be sanitizing the surface of the booth. So on voting day, the same kind of system is followed. Obviously, the voting stations are different. We have our permanent voting stations, our temporary voting stations, usually tents. We have voting centers. We do also have mobile voting stations. In each instance, the obligations and the voting process on voting day follows this same sequence of a person being assisted by a queue official, a queue walker. We have somebody at the entrance. The person who's at the voters' roll desk will then continue to issue the, to check rather the voters' roll and the ID. The inker will ink with a disposable pad. Ballot papers will be issued in this on voting day, not with, there'll obviously not be the 2 envelope system. People will be directed to the different ballot boxes. If we look at how that translates into the COVID voting process, we'll see that there's, again, at each stage, election officials have been trained to follow that voting process all the way through to ensure masks, distance, sanitizer are used on a consistent basis. After the voting station process, we have the counting process. And again, a counting process will take place in a relatively confined space. And so we have to, again, ensure that all of the different protocols are in place. This has been part of the training. Party agents are made aware of this. And the layout of the voting station, of course, when it's converted also into a counting station, has to take account of this. So the results process is, as most of you know, we vote, we count in the station. The result slips are then taken to the municipal location where the results slips are scanned and verified before being captured and saved and printed. Then they are taken through, there are exception reports, these are managed. They are taken through to the results centres in the provinces and then at national and received by the Commission at the same time that all of you in the media receive them. Very importantly, we have got procedures in place for the rollback of PPE, and this includes also making sure that our election officials do keep all of the disposable buds and other PPE associated materials in separate bags so that these are able to be taken back during the rollback process. So I hope that that's given you all some idea of how this process is going to unfold, and there may be questions, but I hope that that is clear enough and that all of you will turn up to vote. Thanks.
Thank you, Ms. Love, for comprehensive presentation as far as COVID-19 measures is concerned for the elections. Without wasting any time, I'm going to call upon one of our special guests, Ms. Roshida Mula, who is the president of South African Informal Trader Association, which is an umbrella body for over 2 million informal traders in the country, to tell us the impact of COVID-19 in the sector, and also how COVID-19 vaccine is assisting the sector to recover. Over to you, Ms. Mula. Hi, Roshida. Over to you.
Hello. Hi, I'm here.
You can see on the video. You can see you on the video.
Oh, I must switch on the video. Sorry about that.
There you are.
Yeah, I am. Good morning to the Minister and all the panelists and every informal trader and customer watching this morning. I would like to thank the Department of Health for inviting SAITA, the South African Informal Traders Alliance, to participate today, and for your leadership in the battle against COVID-19. What an experience. What a turbulent time the informal traders experienced. You know, I'm not only the president of SAITA, but I'm also a mother, a grandmother, a wife, and have many friends, and someone that's living with comorbidities. I am 68 years old, going on for 69, and yes, I have quite a number of comorbidities. I cannot tell you enough how important it is for you to get the COVID vaccination. The whole idea behind the vaccinations is to reduce the risk of harm from COVID-19, which includes reducing our risk of being hospitalized and of dying. Some of you may be hesitating, as I once was, Some of you may think there's not enough research that has been done. Some of you are listening to a lot of stories, which is still currently very much on social media. I understand that people are scared and nervous, but I want you to know that I am living proof that COVID-19 vaccinations are safe and effective. I want to share my vaccination experience with you today. I want to plead with you to listen to the experts, to the doctors, to the researchers, to the specialists, and not to your friends and bad news on social media. You know, I was just as cautious in the beginning, but my husband went through it and he had no after effects, side effects, nothing at all. Right up until today, he is still a healthy, running around 71 years, going to 72. You know, the people that we trust to look after us when we are sick and when we are vulnerable are our doctors. So our doctors, those are the people that we need to listen to. And I personally have been informed by my doctor that it is very, very important for me to have it. Now, leading a sector like the informal sector, you know, we can actually say that we are frontline workers. We are in the open areas, we are close together, and therefore it is vital that each and every informal trader ensures that he protects not only himself or herself, but the traders in and around him, as well as the customer base that they supply. More important is the fact that vaccines will get the economy back on track. Now, we all know the suffering of the informal economy during lockdown periods. Many informal traders basically went to the poverty line because informal traders survive day in and day out. You are not an informal trader by choice. You are there because of survival. A mother will not let her children go hungry, so she would risk, even during the COVID period, to go and sell those potatoes and tomatoes and bring back money to feed her children. So therefore, it is very, very important, and I'm particularly speaking to the informal traders, as I have engaged them, you know, often on this, and the stories are still coming through, that there are many of them who fear the vaccine because of what the neighbor's saying, what the next door trader's saying. But we want the Department of Health to give more education, more directly to the informal sector, even setting up mobiles within the informal big trading areas. You have trading areas where you found thousands, hundreds of traders in one specific open space. And we'd like to engage the ministry once after this conversation has taken place. We are still concerned. We also face harsh restrictions on our movement, which impact on our business severely. We have the power, though, to determine how bad the fourth wave is going to be for all of us. We cannot face another major lockdown. We have to show up for our vaccinations. Every single one of us has to become a champion for vaccinations. Because when we do that, we become the champions of the future. As SAITA, we have already started doing this. Recently, we hosted a webinar on vaccines for our members, where doctors shared information on how they work, addressing misinformation, and answering the questions. I encourage all associations to do the same. I have a number of comorbidities. I have high blood pressure, I've got diabetes. Yet at the beginning of the vaccination program, I was hesitant. For all the reasons that maybe you are all feeling cautious out there who are not vaccinated, but I decided, stop listening to the noise and start hearing what doctors say. So it was a process, I tell you, but I was determined. I went to the vaccination site 5 times. The first time, because of my comorbidity, I'm on warfarin, so my blood was too thin. I went back the second time, my blood was too thick. The third time, there was no vaccinations available, but I persisted. The 5th time, I was ready and got my vaccination. That was in July. And I have now my 2nd vaccination as well. My final message to the minister is this. As SITA, we pledge our full support to ensuring that we do all we can to get as many vaccinated as quickly as possible. My final to all our people in this, the holidays around the corner. We all want to work to make a living and to be with our families and loved ones. Let's get vaccinated so that we can do this safely and get back to living. I thank you.
Thank you, ma'am, for your powerful message. Indeed, it's our collective responsibility as all sectors of the society, whether formal or informal, to ensure that we empower our people with positive message in order to make a well-informed choice. Thank you, and we believe that you will continue to preach this message, good message within your sector to ensure that your members, they also preach this message to their clients. Thank you, ma'am. You can switch off the video. Without wasting any time, I'm going now to take the questions. We are now on the media interaction sessions. I'm going to read out a few questions that I've received through the WhatsApp line. They read as follows. Minister has announced that there will be a voucher for the elderly citizens who will be vaccinated for the first time, will be qualifying to receive a voucher of about 100 Rand, a grocery voucher. So the first question is, how are they going to access this voucher, and how will they know that they qualify to get a voucher? So does vaccinating automatically mean you qualify for a voucher? How are they going to get this voucher? Number 2 is, people argue that the department should be focusing on booster shot or booster jab instead of focusing on vaccinating children. What is the department's response on this? The third question is, what are the targets for 12 to 17 age group? Are the targets part of the 70% targets that have been set and announced earlier on? The other question I see Ms. Love has already responded to on the provisions for people who are isolating due to the COVID active status. I see she has responded here in writing. The last question is this reads as follows. The rates of infection, mortality, hospitalizations are going down. Are there any plans by the government to further relax the lockdown restrictions? I'm going to hand over to Minister and to assign these questions to members of the panel. Over to you, Minister.
Thank you very much. Thank you very much, Foster. Thanks. And thanks to Ms. and Ms. Muller for their contribution to this morning's briefing. A very informative and very strong message of encouragement also from Ms. Rashida Muller. Thank you very much. I'll leave the voucher details to acting DG and the team, Dr. Chris will decide who will be best positioned to answer that question. Now, the focus on boosters for adults rather than vaccination of children. Now, as we announced 2 weeks ago, we are actually doing both, although we are again informed by the medical science. The medical science at this stage does not advocate for general booster vaccinations for general members of the public who must come forward for vaccination. We did announce 2 weeks ago the categories of people who are immunocompromised, those on renal dialysis, for instance, those on various chemotherapies and also radiotherapy for cancer, and also those on the steroid therapy for some of the autoimmune diseases. So there are a number of categories of people whose immunity is compromised, where we did announce boosters, which will be recommended, which are now allowed on the advice of the medical practitioners. So that is one. But we also did say that there is a process which is still going through approval by the South African Health Product Regulatory Authority, SAPRA, to approve a study for a booster shot for the healthcare workers, which will be part of an additional study to see the effects of the booster. So as we opened up for the 12 to 17-year-old children, we are at the same time, based on the available medical science, progressively opening up where we have been advised by the experts that we should provide the additional boosters. But at this stage, the medical science does not advocate for a general booster, because what the indication so far is that the protection after what is approved for each vaccine in terms of the 2 doses vaccines and the 1 dose in terms of our case with the J&J and then the Pfizer, that is still adequate. So it's not as if where it's advised, we have not heeded the advice. Now, in terms of the target for children, we have emphasized the fact that our target is the risk, the population at high risk, which is based largely on age, because age also goes hand in hand with various comorbidities. So our main target remains the adult population, but within the adult population, especially the 50 plus, and also especially the 60 plus, 60 years and older. So those two, let me just say, therefore, our main focus is people over the age of 50. We're still also looking at coverage of the adult population as a whole. So our 70% target still remains for the adult population. We provide the service for those under the age of 18 because of the risk which has been have been admitted, some of them with serious illness, and unfortunately some have even succumbed. So we're providing that service. But because it's still the lower risk, we're not really putting all our energy and efforts in terms of reaching the younger people. So that message, I hope it's quite clear. The question of relaxation, whether because of the low infection rates, we are considering a relaxation. We are already at the highly relaxed stage of level 1 of the adjusted restrictions. So at this stage, as a health department, we have not first of all, we have not received any advisory from our Ministerial Advisory Committee to say that we are at the stage where we can actually just relax everything. As I've mentioned in my input earlier on, we are very wary of the calls from some quarters that government should do away with the state of disaster, because we believe that if we then remove all restrictions and all advisories, all, just remove all the personal health protection measures, we will be opening the country for a serious catastrophe in terms of, a spike of infections, a return to very high levels of infections. We have seen already, as I've mentioned, experience in other countries in the world. So we don't want to get there in terms of, we are not advocating and advising government as a health department to really go the route of total free for all, because we believe that, we know that on a daily basis, as the National Institute of Communicable Disease is reporting from our laboratories, the numbers are there to show that the virus is still in our midst, even though we're talking about between 1 and 2% positivities. What it says, it's still positive. We still have new infections every day. It's just that the numbers are lower. But if we had to completely relax and have free movement, gatherings, and stop every prevention, there's no doubt that we're going to get back to high infection rates. So I will ask Acting DG to allocate on the issue of the vouchers, but also they can pick up to add on some of the areas. I would also still, Mr. Mohale, still propose that Ms. Janet Love comes back on the matter which she dealt with on the platform, just so that those who might be listening and not having access to the platform can also benefit from that answer. But let's start with the Acting DG and the team, just to pick up on some of the issues.
Thank you very much, Minister. Good morning to you, Deputy Minister, and to Deputy Commissioner. So just briefly, I'm going to ask Mr. Garang to respond to the question about the vouchers in a moment, but I'll just cover a little bit more detail about the boosters. So the science is changing all the time, knowledge is changing all the time, and we are following what is happening in a number of other countries. And basically, we're at the position at the moment where we don't have widespread coverage. We don't have sufficient widespread coverage in the country to be really focusing on boosters. But the population of healthcare workers are a particular challenge for two reasons, really. One is they're on the front line, so they are exposed to more infections than everybody else. But the second one is that they were vaccinated a long time ago. And so the interval from their doses of vaccine to now has been the longest. And we want to establish just how much of an impact it does make to have a booster dose for healthcare workers, knowing that we are probably doing good in boosting their immunity. So it'll be done in stages. So for now, the decision has been to pursue Johnson & Johnson as a booster dose for healthcare workers, but there may well be the introduction of other vaccines as boosters, and that has been under discussion for some time. And although there is a recommendation that it is now safe to do it, it hasn't been through the necessary regulatory steps yet. So until that is done, we are not introducing Pfizer as a routine booster for anybody, including healthcare workers, just yet. There's been a question, and it was raised briefly, about people with immunocompromised conditions, and that includes children. So what's the Vaccine Ministerial Advisory Committee has distinguished for us is the difference between additional doses and booster doses. And what they've advised and what we have done is to make it possible for people who have immunocompromised conditions, and there's a specific set of them. We're not talking about all comorbidities, but a specific set of immunocompromised conditions, that an additional dose will be given very shortly after the last of the primary schedule. So the primary schedule at the moment for Johnson & Johnson is still 1 dose, and the primary schedule for Pfizer is 2 doses, 42 days or more apart. Those are our present schedules. And so for those groups of people who have immunocompromised conditions, they will be able to get a 3rd dose 28 days or more after their initial dose. There's some discussion about that interval because the targeting of the interval is slightly different for people with living with HIV who have not mounted an adequate immune response compared with people, for instance, who are on long-term steroid therapy. So we're just finalizing that, and we expect to get that advisory today or certainly over the weekend, and then we will begin to implement that. My last comment is about the second doses and the question that was asked about why we're vaccinating children rather than chasing after people with second doses and boosters for those who actually want them. So far, up to last week, there are about 900,000 people who have received Pfizer first doses who have not come for a second dose yet. About 40%, that's more or less 13% of those who have had a first dose have not been back for a second dose yet. Obviously, some of them, it's not their turn yet. But about 40% of people who have a first Pfizer vaccine come back on exactly 42 days. And then there's a constant decrease in the number up to about 100 days. And then, of course, some people don't come back even after, or haven't come back yet, even after 100 days. So those are the people that we want to chase up. And in the over 60 age group, there are about 280,000 people who are either not yet eligible for their second dose or have failed to return, and we need to go and find them. That just gives some indication, and as the figures are analyzed more, we will publish them. So, Minister, with your permission, I'll ask Mr. Tana just to answer the question on the vouchers. Thank you.
Thank you, Acting DG, Minister. So I'd like to talk briefly about the Nando's vouchers. So as the Minister has reported, it's 1,000 vouchers to the value of 500 Rand. We are going to basically be identifying 15 teams in each province with the highest number of vaccinations, and each member of these 15 teams, whether a vaccinator or a support person, are going to receive this 500 Rand voucher, and as the Minister has indicated, it will happen after the voting day. Further mechanics of this will be explained to the provinces on how this will work, and we will publish the results of these sites publicly. I'd like to, through you, Acting DG and Minister, with your permission, ask Dr. David Harrison to just briefly talk about the ShopRite vouchers for the elderly. Thank you.
Thank you very much, and good morning. So all people aged 60 and older who are vaccinated during the month of November will automatically receive notification of a voucher. So we will be publicizing that from next week in all 11 languages across at least 11 radio stations, much bigger marketing, particularly to ensure that those people who struggle to come forward because the taxi fare might be expensive and they don't have even that amount of money to come forward to vaccination sites, that we can offset some of those costs. So people will automatically receive an invitation to get a voucher. For POPI reasons, they will need to opt in by just dialing to say yes. Partner here is ShopRite's, Checkers and USave. And so by dialing in, they will then be given access to the money market account of ShopRite, which protects their money. They can't lose their voucher once they're registered there. that money is available to them. And we're really hoping that through this way, we will be able to significantly bump up the number of people aged 60 and above who are able to come forward. All the interfaces, all the SMS and the messaging that is required to access this money is free to the user. So there's no additional cost. It really is just trying to ensure that we overcome the cost of getting to the vaccination, which of course is by far and away of far greater value than the voucher itself. Thank you.
Thank you. Minister, you want to chip in before I take the second batch of questions?
I think I had invited the Deputy Chair of the IEC still to respond, for the purpose of those who might be listening, just to say something on the matter which had been raised.
Thank you, Minister. I think there were just a couple of questions. The first one is whether we have been able, as the Electoral Commission, to make provision for any person who is self-isolating. Unfortunately, that isn't possible, as I think all of you are aware. We, even when you go and see a medical professional, if you are self-isolating, the medical professional needs to be notified in advance to take necessary precautions. And this is not something that we can expect of our electoral officials. And in a sense, we believe that we would be playing with fire by pretending that we're able to do that. The second question was whether or not we have got any plans to have a drive-through facility for voting. I know that there have been images of this in other parts of the world. We don't at this stage have such a setup, and obviously we are looking, as we always do, at international best practice, and COVID lessons are one of those that we would look at. We would have to weigh up what logistics and facilities exist, and logistics would be expected of us relative to the potential impact and take-up that it could have, and that's something that we would think about going forward. And lastly, vaccine availability, in terms of our discussions with the department, is not something that is restricted to a person who is registered to vote. We encourage anybody, we encourage everybody to vote who is eligible. We encourage everybody to get the vaccine. Thanks, Minister.
Back to you, Mr. Mohale.
Thanks,
Thank you, Deputy Chair.
Thanks, Minister, and thanks, Deputy Chair, for responding to the two questions that were directed to IEC. I'm going to take the second batch of questions, starting with the voucher issue. Are the Shoprite voucher linked to the ID of the vaccinees to ensure that indeed the right people qualify for these vouchers, or anybody can redeem on their behalf? The second question is related to vaccine. Surprise approved Sinovac CoronaVac vaccine produced by Sinovac around July. When is the department going to start administering this vaccine? The third question is about the pop-up sites which have been announced by the minister. Will this pop-up sites going to begin rendering the service from tomorrow during the special voting, as Mr. Janet has indicated that the IEC is going to start the process of special voting tomorrow? Are the pop-up sites also going to start tomorrow? The other question, are there any plans for the government to introduce mandatory vaccinations? The last two questions, by when is South Africa going to expected to reach herd immunity, and at what percentage? The last question is around the FDA, the decision by the US to approve Pfizer for inoculation of children from the age of 5. Is South Africa considering doing that just like they did in America? Thanks, Minister and members of the panel.
Thank you, Minister. The only question that I think is directed at me, which was I had covered, was the issue about whether pop-up sites would be available on special voting days or only on voting day. My understanding is that the department is preparing for voting day and not for the 2 special voting days, but I'm sure that, you know, that's currently the arrangement.
Thank you, Ms. Janet. Over to you, Dr. Chris.
Yeah, thank you very much, Foster. So I'll ask Dr. Harrison to speak about the voucher and how it works with ShopRite checkers again and clarify that, since he's working with it. And I'll ask Mr. Tanner to talk about the pop-up sites. So briefly about the Sinovac. The vaccine is indeed registered in South Africa, but it is registered under a number of conditions. And just this week, we've been having a number of meetings about the process to the finalization of those conditions. There has been progress made. They related to the collection of further data and some studies, which either have been completed or are going on at the moment. And I'm pretty sure that we'll start to see movement on Sinovac in some way or another within the month of November, but I'm not going to say more about that. The questions about making mandatory, I think everyone in government has been quite clear. The president, the minister, all the interviews I've also handled, all of us have said there'll be no national mandate or no national compulsory vaccination. There are lots of other pieces of legislation in the country that make mandating of vaccination appropriate in specific environments, and those are the environments that will take mandating forward in a more responsible and targeted manner. As far as herd immunity is concerned, nobody's talking about herd immunity anymore. It's an elusive goal that may have been mooted in the early stages of vaccination, but I think we've all learned by now that it doesn't work quite like that. There are lots of other moving parts in achieving herd immunity. And even if you do the scientific calculations, this is a very, very elusive goal because of the changing of variants and the ability to target and so forth. The question of Pfizer vaccine being used in the United States from 5 years of age, well, I think we all know we are not the United States. We're nowhere near the kind of coverage, and we have to take our own population circumstances into consideration. So if Pfizer or any other vaccine manufacturer for that matter approaches our regulator, they will consider the approval for an age group through the normal regulatory process that's applicable to South Africa. And they will then, once that is done, the Ministerial Advisory Committee will advise us whether they think it is an appropriate thing to be doing in our environment. So we are a long way away. We have a very specific process of how we tackle these things, and we won't be vaccinating children of that age in the foreseeable future. Thank you. David, would you like to answer the question on the vouchers and then hand over to Garang? Thank you.
Thanks very much. So just to take you through the process, and yes, I mean, here what we're trying to do is ensure that that people over 60 have opportunity, but that they're also protected through this process. So as I said, we will be advertising widely, hopefully attracting a lot of people into the vaccination sites from next week. The system itself will go live on the 4th of November, but anybody who comes for vaccination from the 1st of November onwards will receive an invitation to get a voucher. So the SMS will go to the cell phone number that was given at the time of registration, and at that point, the person who's age 60 or above will be invited to opt in for a voucher. We want to give people the choice to do that so that we're compliant with privacy requirements. So they will opt in through a very easy process, a short code SMS, and all they have to do is press yes, and then they're into the system. Their cell phone number then goes to ShopRite, as I said, is our partner, and ShopRite will then be in contact with them to provide the voucher. Now, to get the voucher, to redeem the voucher, people will have to then provide their ID or passport number as part of the registration to put that money into a ShopRite wallet. And the reason we're doing that is precisely to protect people over 60. We want to ensure that it is linked to an ID number or passport number that they themselves have given to ShopRite. And that means that that money is always safe. It can't be lost. The voucher can't be redeemed by somebody else. And what ShopRite has done has set up kiosks across all of their stores, ShopRite, Checkers, and USave, that if people have any problems, they can go to the kiosk and it'll be sorted out. In this way, we're hoping that we'll be able to have 100% redemption of the vouchers and create this sort of positive feedback that that goes back into communities, that people understand that when they come forward, they derive a benefit, and hopefully through the experience of the vaccination site, they see that it's really not that bad, that some of their anxieties they might have had were misplaced, and they'll be encouraged to come back for the second vaccination if they have to get Pfizer. So that's the process that's underway. We're piloting it through the month of November. We have funding at the moment for 260,000 vouchers, which would in effect be sufficient for double the number of vaccinations per day of people over the age of 60. We're really hoping that this is going to be a success because it would be fantastic to extend it to people 50 and 60 because they obviously are a priority group that we have to get to before the fourth wave. Thank you. Back to you.
Kiran, go ahead.
Thank you, Acting DG. I think the short response to the question is that the pop-up sites will only operate on the Monday, the 1st of November, when we are likely to see bulk of the people coming forward to vote. Let me use this opportunity to also say every person that votes at the pop-up site is going to increase the chances of that vaccination team receiving that 500 Nando's voucher, each member of that team, even higher. So please go and support your local vaccination teams, voting stations that will have pop-up sites, and get yourself vaccinated. You are going to increase the chances of your healthcare workers in your neighborhood for them to receive this voucher. And likewise, we encourage healthcare workers to encourage members of their community to get themselves vaccinated on the day at the pop-up site. Thank you.
Thank you, colleagues, all the responses. Before I hand over to the Deputy Minister, Dr. Domo, to do the wrap-up, I'm going to allow the Minister to do the summary of the responses, the parting shot. Minister?
No, thanks, Foster. My network is a bit difficult because of the power. But just briefly, I wanted to just add, I saw on the chat, on the Q&A, somebody was still not happy about the response about herd immunity. What is our coverage? What is our target in terms of herd immunity? Now, we have always emphasized the fact that our target is to achieve 70% coverage of the targeted population at this stage, the priority being adult population, that's people 18 years and above, even though we have also within that did further differentiation to say higher priority is 50 years and above. But we still focus, that's why even when I reported that we are confident that by middle of November, we should be able to reach the 40%. of the adult population, at least with one jab. We're still hoping that by the end of December, we will be closer to the total of 70% of the population. I want again to emphasize the fact that while we keep saying that is because the capacity to provide that level of coverage within our services, both in the public and private combined, that capacity is there. So all that we actually need is to mobilize, to encourage more people to come forward and receive the vaccination. So the 70% of the adult population, in terms of capacity to provide the service, that capacity is there. And what is making us not reach the levels at the higher level of what we desire, it's simply in terms of people coming forward. So we would want to keep on encouraging, people mobilizing our communities to make sure that they come forward so that we can achieve that target, which will provide sufficient protection for the population. And that is the 70% of the adult population. And so as much as we've now opened up for the 12 to 17 years old, they do not constitute part of the target which we are chasing to make sure that because the highest risk is within the adult population. So that's exactly what we're aiming to achieve. Thank you very much, Mr. Mohale.
Thank you, Minister. Thanks, colleagues, for all the responses. I'm now going to hand over to our respected Deputy Minister, Dr. Sewumseni Dhlomo, to do the closing remarks. Over to you, Deputy Minister.
Thank you very much, Mr. Mohale, and good morning to our Minister. I hope that I'm audible. I do have a challenge, however, but I'll soldier on. Maybe let me start with a question that probably comes up all the time. Is the government planning to have a mandatory vaccine? Mandatory vaccination to South Africans. Now, the Minister has been outspoken on this matter, and today the Minister has made announcements of various sponsors, Nando's, Uber, retail shops, like USAID Checkers and others, foundations, including Bill and Melinda Gates Foundation, to say there may be some other people out there who are going to give us certain incentives and support to encourage. And like the last speaker before the Minister is saying, we encourage people to support their local vaccination teams. We encourage anyone, but there's no indication. All the time the Minister makes these addresses, he indicates that there's no mandatory policy of government for people to be vaccinated. It's all encouraging, motivating, requesting, and giving them that part. So that remains our focus. We want to thank Ms. Roshina Mula for her really very motivational talk that she gave to us here, and I'm sure South Africans will take heed and really move on with that part that she gave us. Thank you very much, Ms. Mula. To Ms. Janet Love, I think you'll agree with me that I would like to commend our healthcare workers and all those experts who have sat down with you and shared these issues that make you to be so eloquent from the IEC and in really putting up a particular program that will assist us to really make sure we adhere to the COVID-19 regulations even during the voting sites. Your plan, ma'am, clearly shows that you're advocating for strict adherence to non-pharmaceutical protocols within our voting stations. We want to commend you for this. In fact, your plan is so watertight, and it confirms what the Minister was saying, that the 1st of November is probably not our major concern compared to the 2-3 days prior to that, today, tomorrow, and Sunday, which may be a challenge in our build-up. So that is something that really came up from you very strongly. Thank you very much, Minister, for highlighting that through your steps, we are indeed on a decline in terms of COVID-19 infections in the country. But however, you advise us in the country to really focus on these non-pharmaceutical protocols. Minister, this week I spoke to one of the experts who's part of the team that advises you, just sharing with her my concerns as to in some of the countries in the world, we see that some of them have had vaccination figures much more higher than ours, but there's some concerns with them having increasing infections. And this expert shared with me to say we should then maybe learn a lesson. We should not abandon the non-pharmaceutical protocols of washing our hands, sanitizing regularly, keep on wearing our mask and social distancing. That's critical because as the minister is emphasizing, the virus is still out there. It's just that we have got low levels, but not completely gone. And thanks also for this announcement of the pop-up sites on the 1st of November. It actually public holiday announced by the president to allow South Africans to go and vote. The priority on that day is voting, actually administered by IEC. It's an innovative program by the Department of Health in partnership with IEC to have these pop-up site vaccination sites for our people taking advantage. So, and it is indicated that it is not going to actually interfere with the precinct of the IEC demarcation zones, but will have these sites available for any South African who, after the vaccination, will then, after the voting, will come to be vaccinated. It's very convenient. South Africans will be having their IDs. So this should not be causing any confusion, which was coming in to say, I'm reluctant to go and vote because I now hear that the department is going to call me and catch me and vaccinate me without my will. No, no, no. Far from the truth. It will be strictly a voting day, and we are just making it convenient for South Africans to come in and, if they so wish, vaccinate on that day. Thank you to all our sponsors for this process that will be very effective. Minister, on your statistics, you mentioned a very important point, that the positivity rate today is sitting way below 2%. I remember, Minister, on the 5th of July this year, we had a positivity rate, the highest we have had, 31%. So really, we have moved and we need to never go back to those areas. We really request and encourage South Africans, go out there, vaccinate, because there is merit in vaccination. We do actually would stem the tide on this COVID-19 infection. Thank you very much, Minister, and to all those who have participated, and to Mr. Foster for hosting us again.
Thank you, Deputy Minister, for your powerful message. And the Minister, thanks for taking us through the keynote address. Our Deputy IEC Chair, Ms. Janet Love, our special guest, Ms. Roshida Emula, for all the good message that you shared with us, and we wish everybody all the best. And let's go there and vote, and don't forget to vaccinate, because it's the right thing to do to protect ourselves and our loved ones. And until we meet again next week, all the best. Enjoy your weekend. Thank you.
Thank you very much.
Thank you. Goodbye.
Thank you very much.
Recording stopped.